right, so we're going to go over acid-base balance. And for this, so we're going to start looking at the basics of ABGs. So for ABGs, you're looking at your pH first. So your pH being between normal being between 7.35 and 7.45. Your bicarb between 22 and 26. And remember, your bicarb is your metabolic buffer, which means when the bicarb is elevated, you're in an alkalotic state. And your PaCO2 being normally between 35 and 45, PaCO2 is your respiratory acid and will help, well, basically when that's elevated, you're in an acidic environment. It's going to really help in understanding those two things in order to kind of get a feel for what you're looking at. So remember, if your bicarb's high, it's usually alkalotic. If your PaCO2 is high, it's usually acidic, and vice versa. So it would be opposite the other way. So when you have an alteration in the respiratory system, you're going to see an alteration in your PaCO2. And if you have an alteration in your metabolic system, you're going to be looking at your bicarb, which is where you would see that alteration. Any pH below 7.35 is acidic, and above 7.45 is alkalytic or alkalosis. So the next thing you're going to do is evaluate your ABGs. And one of the things I'll always tell you is use arrows, and you'll understand when we get to a different slide. So you're going to look at whether your pH is normal, acidic, or acidotic, or alkalotic or alkaline. So if it's acidotic, you're going to do an arrow down. If it's alkalotic, your arrow would be up. Then you're going to go to your CO2, which remember, this is telling us, is it respiratory or is it not? And you're going to do equal if it's normal. Acidotic would be low, or alkalotic would be high. And again, our CO2, we're looking at whether and I didn't do this with the first part, I'm sorry, but we're looking at whether our PaCO2 is lower than 35, which would be alkalotic, or greater than 45, which would be acidotic. And remember, for our pH, if it's less than 7.35, it's acidotic, and if it's greater than 7.45, it's alkalotic. Then we get to our bicarb, which is our HCO3, and we're going to see, is it normal, which would be 22 to 26? Is it acidotic, which would be low, below 22, or is it alkalotic, which would be high, above 26? You're going to match the CO2 in the bicarb with the pH. So we'll go through that in a minute, but remember, if our CO2 is high and our pH is low, then we know that we have a respiratory acidosis. And if our bicarb is high and our pH is high, we know we have a metabolic alkalosis, and we'll go through all these in a few minutes. But that's what I say by matching, and I'm going to teach you a method that'll help you with that as well. Then you're going to look at your CO2 and your bicarb. Do one of them go in the opposite direction? If so, we know that our body is starting to compensate, and we'll go through that as well. And then the next step normally is to look at your PaO2 and your O2 sat, and are they normal? Again, for this course, you don't need to know that. But that's what you would do if you were evaluating these in a patient, for instance, that was on a ventilator and we were considering changing settings, etc. Compensation. Again, remember that CO2 is your acid, and it's your respiratory acid, and your bicarb is your base, and it comes from the kidneys. Your body's going to compensate by altering those two things to keep our pH within a normal range. It's kind of like, a balance all the time. So for this, we're looking at this acronym is ROME, respiratory opposite metabolic equal. When I told you to draw your arrows, this is the purpose of that. So anytime you have a patient who has respiratory acidosis, the pH is going to be low, meaning it's going to be less than 7.35, and our PaCO2 is going to be high or greater than 45. Our respiratory alkalosis, the pH is going to be high, and the PaCO2 is going to be low or below 35. So you see our arrows go in opposite directions. With our metabolic acidosis, our pH is going to be low, and our bicarb, because remember our bicarb is our buffer, is also going to be low, going in equal directions. With metabolic alkalosis, your pH is going to be elevated, and your bicarb is also going to be elevated. So with respiratory acidosis, it's a result of excess carbon dioxide in the blood, also known as hypercapnia. This is often the result of a decrease in alveolar ventilation, shallow respirations, respiratory depression, or respiratory cessation, so if someone stops breathing. Signs and symptoms would be headache, blurred vision, breathlessness, restlessness, altered mental status, including apprehension, disorientation, lethargy. Sometimes people become very almost combative. It's just it's a change, a sudden change in their mental status. They can also, so they can get lethargic, they can have muscle twitching or tremors, convulsions, and potentially coma. The respiratory rate is often rapid at first because the body's starting to try to compensate, but it's going to gradually slow as the CO2 level begins to increase. The key assessments are vital signs. As we talked about, there's these changes in the respiratory system. The respiratory status, so listening to their lungs, how are they ventilating, what's happening. Their mental status, as that can also be a big change, and the neurological status. So we're doing a thorough neuro, mental status, respiratory, and vital signs, key assessments. The kidney's going to eliminate, to compensate, the kidney begins to eliminate the hydrogen ions and retain bicarb. With respiratory alkalosis, when we have this occurring, you're going to have a pH that's greater than 7.45, a PaCO2 or PaCO2 of less than 35. Your bicarb is usually normal or slightly off. The respiratory alkalosis is a result of hyperventilation and a decrease in CO2. Causes can be pulmonary disease such as COPD, congestive heart failure, and potentially result from being at high altitudes, which you hear is the altitude illness or altitude sickness that occurs when people are at high altitudes. It can also be caused by things such as fever, anemia, cirrhosis, and even sepsis. Sometimes we see this as a result of inappropriate vent settings. So when someone's on a ventilator, sometimes when we do the initial settings, we'll check our ABGs regularly to make sure, but this can be an alteration that occurs just because of the vent settings. So they may need to be have a rate or volume change in order to correct this. Signs and symptoms are dizziness, confusion, tingling in the extremities, which is called paresthesias, convulsions, and potentially coma. Key nursing assessment, again, is your vital signs, especially your respiratory rate and the patient's neurologic status. To compensate for this, the kidneys are going to conserve hydrogen ions and excrete bicarb. So with metabolic acidosis, your pH is less than 7.35, your PaCO2 is normal to slightly low, and your HCO3 or your bicarb is less than 22. Your CO2 is usually normal, and it won't be tricky on these types of exams. I'll make them normal. We wouldn't expect to unless the patient's compensating it to be a regular uncompensated imbalance. So just know that that's the normal parameters for metabolic acidosis, less than 7.35, less than 22, and the PaCO2 is usually normal. So your metabolic acidosis occurs from a loss of bicarb. It can happen very quickly, slowly, or slowly over time. An example would be a patient that you see where this happens fast would be a patient with lactic acidosis or hypoxemia. They're going to develop it over a period of time would be someone who's developing it over a period of time would be someone with ketoacidosis, which you would see with your type 1 diabetic patients, or someone with renal failure, chronic renal failure. You'll sometimes see that called chronic kidney disease or CKD. Clinical manifestations of this include headache, lethargy, and eventually progression to more serious neurologic issues such as confusion and potentially coma. You can also see GI issues or gastrointestinal issues such as nausea, vomiting, and diarrhea, and cardiovascular impacts, which can be dysrhythmias and hypotension or low blood pressure. Assessments include close observation of the vital signs to check for these things, as well as assessments of the neurologic, gastrointestinal, and cardiovascular systems. To compensate for this, your lungs are going to eliminate CO2, and the kidneys are going to try to conserve your bicarb or HCO3. For metabolic alkalosis, your pH is greater than 7.45, your PCO2 is usually normal, and your bicarb is greater than 26, because remember, your bicarb is your buffer or your alkalotic component of your metabolic system. So metabolic alkalosis is the result of a loss of metabolic acids or an increase in bicarb concentration. This is usually caused by vomiting, hyperaldosteronism, or use of diuretics. Signs and symptoms of this include weakness, muscle cramps, hyperactive reflexes, and tetany, which is because of the increased binding of calcium to plasma proteins. You can see confusions, convulsions, and atrial tachycardia, which basically means a fast atrial rate of the heart. The patient may have slow, shallow respirations if they're trying to compensate by holding in CO2, which is our respiratory acid. Assessments that are crucial are your vital signs, especially close attention to the respiratory status, assessing their musculoskeletal findings, and also their serum electrolytes. As we mentioned, you could have that increase in calcium that's binding to the plasma proteins. To compensate for this, our lungs decrease ventilation to retain CO2, and our kidneys are going to try to conserve our hydrogen ions and excrete our bicarb. So compensation. Compensation, we have partially compensated patients. The pH, CO2, and bicarb are all abnormal. If they're compensated, the pH is normal, but the CO2 and the bicarb are abnormal. So here are examples. So when we have a patient who is partially compensated, all three of these are abnormal. So if all three of them are abnormal, how am I going to know where I'm going with this? So as I mentioned to you, if we do our arrows, I see that my pH is low, my CO2 is high, and my bicarb is also high. So if you look at your acronym of ROME, what matches are these two? Respiratory is opposite. Metabolic would be equal. So we know that the original issue here was respiratory acidosis. Why is my bicarb up? Because my kidneys are excreting the bicarb to try to balance out and bring this back to normal. If we go to this other one, this is equal or normal, 7.36. But we know it's on the low side of normal, right? So that's the other critical part of here to know which way it was. Our CO2 is elevated, and our bicarb is also elevated. So I know that I have a compensated respiratory acidosis. Why? This is on the low side of normal, and that would mean it's coming up. So I know those match up. Respiratory is opposite. So my CO2 and my pH align, and my bicarb was coming in. My kidneys are excreting the bicarb to buffer it. So that would be a compensated respiratory acidosis. A big thing when we're looking at this is how do we prioritize care? How would we, how would we know what's most important thing to look at? So when we look at patients, and you're going to see this throughout nursing, is who do we see first? What's the most important? And it's the patient that either has signs and symptoms, significant signs and symptoms, or someone who has the greatest risk for something. So what is the highest risk? Does a patient have respiratory acidosis or alkalosis? Who is at risk for for respiratory alkalosis? Someone who's hyperventilating. So we would know that would be a patient. Who's at high risk for developed metabolic acidosis? Someone with diarrhea, etc. So you want to look at that and know, do they have signs and symptoms? And are you starting to see alterations in their vital signs, in their respiratory rate? So that would mean that they're a priority. Someone who already is showing signs and symptoms, or advanced signs and symptoms, or someone who has had a change. So that's how you prioritize patients in these types of situations. So we're going to do these practice questions. What I would recommend that you do is go through them yourself, pause this, go through them, and then listen to it to see and check your answers. We're going to go ahead and I'm going to give you the answers. So number 1 is metabolic acidosis, because we have a low pH and a low bicarb. It's uncompensated. So remember, metabolic is equal. So our bicarb is low as well as our pH. Number 2 is metabolic alkalosis because we have a high pH and a high bicarb, and it's uncompensated. 3, we have, with this one, how do you know the direction? 7.44 is the high normal. So we have a compensated respiratory alkalosis because our pH is 7.44, so it's normal. So if I were to draw my arrow, it would just be an equal, but it would be on the high side of equal. And I have a high CO2. I'm sorry, the CO2 is low. I'm looking at something else. And the bicarb is low. So if you remember Rome and put your arrows in, you'll see that it would be a compensated respiratory alkalosis. Number 4 is uncompensated respiratory acidosis. Why? My pH is low and my CO2 is high. I hope this helps, guys. And again, as always, make sure you're using the other resources that you have and doing tons of practice questions.